In this video, we will talk about the role of vitamin D in bone health, so make sure to watch the full video. Vitamin D is vital for maintaining strong and healthy bones, playing a central role in calcium absorption and bone metabolism. It helps regulate the levels of calcium and phosphorus in the blood, which are crucial for bone formation and strength. Without adequate vitamin D, bones can become weak, increasing the risk of fractures and conditions like osteoporosis. Understanding the role of vitamin D in bone health can guide effective strategies for prevention and management of bone-related issues. This includes considering dietary sources, sunlight exposure, and supplements to ensure sufficient levels of this essential nutrient and support overall skeletal well-being. 1. Understanding vitamin D. Essential for bone health. Vitamin D plays a crucial role in bone health by regulating calcium and phosphorus levels in the blood, which are essential for maintaining strong and healthy bones. It helps in the formation of bone tissue and supports bone remodeling, a process where old bone is replaced by new bone. Without adequate vitamin D, bones can become thin, brittle, or misshapen, leading to increased susceptibility to fractures and bone disorders. Understanding the fundamental role of vitamin D in bone metabolism is essential for maintaining bone strength and preventing conditions such as osteoporosis and rickets. 2. How vitamin D enhances calcium absorption. Calcium is a vital mineral for bone health, but its absorption is highly dependent on vitamin D. Vitamin D promotes the absorption of calcium from the digestive tract into the bloodstream, ensuring that enough calcium is available for bone formation and maintenance. It also helps regulate calcium levels in the body by influencing calcium storage in the bones and preventing excessive loss through the kidneys. Without sufficient vitamin D, the body cannot absorb adequate amounts of calcium, which can lead to weakened bones and increased risk of fractures and other bone-related health issues. 3. The link between vitamin D deficiency and osteoporosis. Osteoporosis is a condition characterized by weakened bones and an increased risk of fractures. Vitamin D deficiency is a significant risk factor for osteoporosis because it impairs calcium absorption, leading to decreased bone mineral density. When vitamin D levels are low, bones can become brittle and more susceptible to fractures. Research has shown that individuals with insufficient vitamin D are at a higher risk of developing osteoporosis and experiencing fractures. Addressing vitamin D deficiency through proper diet, sunlight exposure, and supplementation is essential for maintaining bone health and preventing osteoporosis. 4. Vitamin D and bone density. What the research shows. Numerous studies have investigated the relationship between vitamin D levels and bone density, revealing that adequate vitamin D is crucial for maintaining optimal bone strength. Research indicates that higher levels of vitamin D are associated with increased bone mineral density, which helps reduce the risk of fractures and bone loss. Studies also show that vitamin D supplementation can improve bone density in individuals with low levels of the vitamin, especially in older adults and those with osteoporosis. Understanding these research findings helps highlight the importance of maintaining adequate vitamin D levels for bone health. 5. Sources of vitamin D. Dietary and sunlight options. Vitamin D can be obtained from various sources, including dietary intake, supplements, and sunlight exposure. Dietary sources of vitamin D include fatty fish, fortified dairy products, and egg yolks. Additionally, vitamin D supplements can be used to ensure adequate intake, especially for individuals with limited sun exposure or dietary restrictions. Sunlight is another vital source of vitamin D, as the skin synthesizes the vitamin when exposed to ultraviolet B, UVB, rays. Balancing these sources is essential for maintaining optimal vitamin D levels and supporting bone health. 6. Recommended vitamin D intake for different age groups. The recommended daily intake of vitamin D varies by age, sex, and life stage to support optimal bone health. For infants, children, and adolescents, adequate vitamin D intake is crucial for proper bone growth and development. Adults also need sufficient vitamin D to maintain bone density and prevent age-related bone loss. Older adults, in particular, require higher levels of vitamin D to reduce the risk of falls and fractures. Understanding the specific recommendations for different age groups helps ensure that individuals receive the appropriate amount of vitamin D to support healthy bones throughout their lifespan. 7. Vitamin D and bone growth in children. Vitamin D is essential for healthy bone growth and development in children and adolescents. It plays a critical role in the formation of bone tissue and the prevention of rickets, a condition characterized by weak or soft bones. Adequate vitamin D levels support proper bone mineralization and growth, ensuring that children develop strong, healthy bones. During periods of rapid growth, such as adolescence, maintaining sufficient vitamin D levels is especially important to support skeletal development and prevent long-term bone health issues. 8. Managing vitamin D levels. Testing and supplementation. Managing vitamin D levels involves assessing current levels through blood tests and using supplements to correct deficiencies. A healthcare provider can order a blood test to measure serum 25-hydroxyvitamin D levels, which indicates the body's vitamin D status. If deficiencies are detected, vitamin D supplements can be used to restore adequate levels and support bone health. Supplementation should be tailored to individual needs based on factors such as age, health conditions, and lifestyle. Regular monitoring and appropriate adjustments ensure that vitamin D levels remain within the optimal range for maintaining bone strength. 9. The impact of vitamin D on bone healing and recovery. Adequate vitamin D levels are essential for effective bone healing and recovery following fractures or bone injuries. Vitamin D supports the healing process by facilitating calcium absorption and promoting bone remodeling, which is crucial for repairing damaged bone tissue. Research has shown that individuals with sufficient vitamin D levels experience faster recovery and improved bone healing compared to those with deficiencies. Ensuring adequate vitamin D intake during the recovery period helps optimize bone repair and reduce the risk of complications, leading to better overall outcomes for individuals recovering from bone injuries. 10. Interactions between vitamin D and other nutrients for bone health. Vitamin D works in conjunction with other nutrients, such as calcium, magnesium, and vitamin K, to support overall bone health. Calcium and vitamin D have a synergistic effect, as vitamin D enhances calcium absorption and utilization in the body. Magnesium plays a role in bone formation and contributes to bone density, while vitamin K supports the regulation of calcium within the bone matrix. Understanding these interactions helps ensure a balanced approach to nutrition, as optimizing the intake of these nutrients together can enhance bone strength and reduce the risk of bone-related disorders. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also, subscribe to our channel before you go.